Welcome to Public Health in Real Life. I'm Ashwin Kadambe, Senior Global Public Health Professional. On the show, we bring to you heroes in public health who have went above and beyond in their careers to make a significant impact in the society, and particularly during this pandemic. We are delighted to bring to you this episode on becoming a leader in public health. And we have an amazing guest with us, Dr. Niketta Womack. Before we introduce our esteemed guest, let me turn to my co-hosts who will introduce themselves and our guest today. So over to you, Kelvin.
Hello, good afternoon, everyone. My name is Kelvin Turner. I'm a public health professional. I currently serve as a regional director at Operation Smile. I'm just very excited to be here today and to join in this, to co-host this conversation with Dr. Womack on becoming a leader in public health. So just very excited to be here today, and thank you guys for joining us.
Thank you so much, Kelvin. I'm equally excited to be co-hosting with you all today and then also to be with the delightful Dr. Niketta. Since the start of the new millennium, public health has emerged from a behind-the-scenes discipline to a widely recognized leader of community and global health initiatives. Now more so with the global pandemic, public health has emerged as a very important topic and field of discipline. Today, we have the delightful Dr. Womack, as we keep saying, who is an epidemiologist with the Centers for Disease Control and Prevention in the Division of Sexual and Transmitted Diseases. In this role, Dr. Womack is responsible for designing, implementing, and evaluating data collection systems. She's a key advisor to the scientific staff on epidemiological data management and analysis for ongoing projects involving SCD surveillance. Throughout her career, she has gained experience in emergency preparedness and response activities, disease surveillance, outbreak mitigation, incident coordination system, and special events, i.e., presidential inauguration. Dr. Womack is also a commander in the U.S. Public Health Service, where she advocates for health and wellness of the nation by responding to public health emergencies and national disasters. She holds an undergraduate degree in biology from Georgia State University, and she received her master's in public health in epidemiology from Tulane University. She completed her Doctor of Public Health Leadership at Georgia Southern University. Dr. Womack, in her spare time, loves to cook, spend time with loved ones, food blogs, working out, and traveling the world. She's a proud member of the Delta Sigma Theta sorority, which she leads and serves those in need within our community. Welcome, Dr. Womack.
Thank you all for having me. I am delighted to be here. And as I've said to you numerous times, I'm truly grateful for the platform that you guys have created to highlight public health and to also have special guests like myself to kind of share our public health experiences and encourage others to seek opportunities within public health. Right? So today I'll be going over pretty much my journey in public health on becoming a public health leader. And in doing so, I'll definitely navigate through the good times and the bad, definitely the lessons learned, hopefully to be of benefit for those that are currently pursuing their education or starting their careers in public health. So the objectives of this presentation is to provide key elements to becoming a public health leader. I'll also share, again, some of my personal experiences as a public health student and professional. I'm also going to walk through the different phases and dynamics of transitioning into the workforce, as well as highlight some of the things that I've learned throughout my career in education as it pertains to the benefits of networking and mentorship. Okay, so this picture here, I always like to, again, make it very personal. So this first slide, I learned how to become the competitor. Learned this very early on in my undergrad experience. I was on the warehouse step team at Clark Atlanta University. And being at an HBCU, or historically Black college and university, you learn quickly that everything is a competition. So in order to be a competitor, or if we're going to define that, is someone who is trying to win or do better than all others, especially in business or sports. So someone who is competing. And so when you're competing for on campus, outside of the STEP team, I feel like everything was a competition. So you quickly learn how to establish tactics, and you learn how to multitask as any student or freshman on a college campus. And early on too, I learned how to develop my leadership qualities. So pretty much going into college, I was a bit of an introvert. I was very active in high school, but still kind of shy. And so being more active in my community and being active on campus helped me to develop better communication skills. It also taught me the importance of integrity and honesty, and also how to work well with others. Just some of those early on leadership qualities that I think we oftentimes overlook when we're growing and developing, that are very instrumental in our growth. Just a second. Also, you want to challenge yourself academically and socially. So again, not doing the bare minimum, but going beyond, and also seeking opportunities and whether it's seeking tutoring or whatever. But again, I used to socially challenge myself because, like I said, I was very shy, but I wanted to put myself in not compromising situations, but, challenge myself in settings so that I can learn how to network and better communicate with others. Also setting realistic goals, and establishing lasting relationship with your mentors and advisors. And I say this early on, if you're in college now, whether grad school or undergrad, it's very important to start developing those relationships, because these are the people you're going to need letter of recommendations from. You're going to need some type of advice or guidance from in some form or fashion. You're going to need to tap into their networks for assistance. So you want to build genuine and lasting relationships with these individuals. So after my sophomore year, one of my mentors, my microbiology teacher, Dr. Logan, was a part of a partnership that we had with the University of Georgia. It's an REU Genomics and Computational Biology internship. At the time, I still had interest in going to medical school, like most biology majors. And so he definitely advised that, I do more interns just to kind of get a feel for what I was interested in. And so when I interned at UGA, the summer after my sophomore year, I quickly realized that I enjoyed being in the lab. I enjoyed being in the lab more so. The part I enjoyed more about lab work was understanding the molecular makeup of a bacteria or disease, and trying to understand pretty much how that, how the bacteria grows and how in turn it impacts human spread. And so that's kind of where my infectious disease interest started early on. And so again, when you're interning, you want to find your niche. And so I feel like overall, looking back, what you learn in the textbook is one thing, but having that real life experience will definitely help you to gauge whether or not it's the career or profession for you. And so again, my goal was still to go to medical school. And so after I returned to Clark Atlanta, after my internship, I started seeking volunteer opportunities at hospitals. At the time, I wanted to be a neurosurgeon. Not sure why I was interested in going that route. And so I started to volunteer. So again, you want to try to find volunteer opportunities in the areas in which you're interested in. And so I began volunteering at Grady Memorial Hospital here in Atlanta. And because I wasn't allowed to be in a surgery room, I got to shadow some of the residents that were covering the nursing station and things of that nature. And so I got a chance to interact with the medical students and some of the others that are working in the area, just to get their take on being physicians and how they like working in a hospital. From that experience too, that volunteer experience, I quickly learned that I didn't like to be in a hospital. More so, again, I consider myself an introverted extrovert. So I do well in interacting with people. However, I knew that it wasn't something I wanted to do on a daily basis. And I did not enjoy being in the hospital setting. And so, I again went back to my interest in infectious disease, and I was watching the movie Outbreak. I'm not sure how many of you guys have seen Outbreak. I guess it's the old version of the movie Contagion. And so after seeing Outbreak, I'm like, oh, that's exactly what I want to do. Like, I want to, you know, I love infectious diseases, a new emerging disease. I want to figure out where it came from, how it's impacting the populations, how to control and contain the virus in a certain setting. And I was like, that's it. That's exactly what I want to do. And so at that time, I reached out to my mentors and had this conversation with them. Like, what is that called? There's a word for it, and it's called an epidemiologist. And so that's when I learned about epidemiology. And my mentor from UGA, because again, every time you intern or interact with a professor, you want to build those relationships. And so Dr. Arnold became another mentor to me. And so I reached out to Dr. Arnold. I told him of my interests, and he recommended that I intern at the CDC. And so at that point, we started applications, and I was able to obtain an internship at the CDC, ironically working with HIV STDs. And I started that spring. So we're going to fast forward and I transferred to Georgia State the second semester of my junior year. And so that's, at that point, I kind of already knew that I wanted to go to pursue a master's in public health. At that point, again, I knew I wanted to be an epidemiologist. And so I started to do more research around it. And so in applying for graduate programs, I wanted to ensure that I was more proactive and more organized in this process. And so I started researching graduate programs. Again, my end goal was to work at the CDC. I interned there, made some contacts, but essentially that was my dream job. I wanted to be an epidemiologist at the CDC. And so I began to research, how do I get a job at the CDC? What are the requirements for becoming an epidemiologist at CDC? And I learned, okay, you need a master's of public health and epidemiology to start with. So it's like, okay, so I started researching graduate programs, and I was advised to take this approach where you, applying for at least 5 schools and 2 definite. So 2 schools where I absolutely met their requirements, I could get in. 2 schools that I can possibly get in, I'm right on the crest of meeting their requirements, and 1 that is kind of far-fetched, but is like my number 1 option, and it would be amazing if I can get into that university. And so I created this spreadsheet because, again, early on, I had an interest in spreadsheets. And so I created the spreadsheet to track all my application documents. I created packages for all of my professors that I requested letter of recommendations from, just so that it was seamless for them. And back then we did not have SOFIS. And so you had to literally mail in your applications and your letter of recommendations and all of that. So you had to be very organized and follow up with your professors accordingly, making sure that they had the letters ready in a timely manner so that you can mail everything in. And so I ended up getting accepted into Tulane University, which was my number 1 school. And following that, I did receive acceptance letters from the other 4 universities as well. And so at that time, once I received my acceptance into Tulane, I started looking into the professors at the university because, again, my interest was infectious diseases. I wanted to learn about outbreak epi and everything. So it's like, what professors did they have at the university that shared a common interest? And so I started my research there. So we're going to fast forward. I'll give you some information too while I was at Tulane. At Tulane, as soon as I got on campus, I started to seek research opportunities. I found an opportunity. Again, I love being in the lab. And so I've always kind of cross-trained in the lab. So that's always kind of been my interest. And so I was able to find a lab opportunity with an entomologist there, Dr. Dawn Wesson. So I was working in the lab with Dr. Wesson. I was the only epidemiologist in the lab, so they never understood, like, why are you working in a lab? You're an epi major. But again, I've always had an interest in lab as well. And so Dr. Wesson also, just communicating what my interests were with her, she made sure that she created opportunities for me to kind of gain epi experience during that time. And I was in grad school in 2005, which was during Katrina. So Katrina hit, I came back home for a little bit. And when I returned, of course, there was a major mosquito problem in New Orleans due to all the sitting water. So as you can imagine, West Nile virus was very prominent during that time. And so she created, we were studying mosquitoes in her lab. And so she created a side project for me where I was doing follow-up data collection for patients that had tested positive for West Nile virus. And so, again, collecting epi data. So she created that opportunity for me. And so early on, again, creating those relationships and making sure that I was always had my end goal in mind with every position that I had, so that whatever experience I gained while I was working in that lab was still in line with what I wanted to do essentially at the end. And so this fast forward, I graduated from Tulane and finished at Tulane, May 2007. I moved back home to Atlanta. I interviewed at Emory University for a position with an HIV research group. And it was a one-year internship. And so I ended up getting hired. So I started there that summer. And again, this was my first real job ever. I've been in school all my life. And so this was the first time I ever worked as an epidemiologist, and more so just had to report to work in a 9-to-5 fashion. And so I can admit that I was not the best employee. And so some of the things I've listed here is like, know what is expected of you and work hard to exceed those expectations, because that's the area that I failed in. And I also failed in time management. I wasn't always on time. I just kind of was, I don't know, still kind of operating as a college student a little bit. And also make note of your deadlines and do not overcommit to work projects or outside activities. And so I really struggled with time management in that position, and also work-life balance. So it is my first job, my first time getting a real salary, having money. So of course, naturally, I want to hang out with my friends more. I want to travel. I want to do all these things. And so that kind of overshadowed some of the work commitments that I had. And so I lacked that balance. And then also this position, I did a lot of data collection. The project was based in Africa. And so again, historically, they have data back to like the beginning of times. And so it was a very massive database. So I really gained experience on managing large databases. And then also it was a lot of SAS coding. And so this position was heavy on coding, which was great for me because, again, that data analysis skill set or that technical skill is what I wanted to build on as well. And again, they had a lab. So anytime there's a lab present in any of the positions I've worked, I've always tried to cross-train in the lab, because the data that you're obtaining from the lab feeds into the databases that are used to do the analyses in my epi role. And so I always wanted to have a full understanding of the overall picture. And so I felt that it was really, really critical to cross-train and to ensure that I always maintained laboratory skills in every position that I worked as well. All right, so fast forward, like I said, I wasn't the best employee. And so I remember, you know, I had not heard anything about them renewing my contract. And so probably maybe a week or two before my contract was ended, I received notification that they will not be renewing my contract. And so pretty much 2 weeks, I'll be out of a job. And so that was a very humble time for me. Again, I was blessed enough to have received an opportunity fresh out of grad school. Literally, I moved back home Friday, interviewed Monday, and had an offer by Friday. So, you know, I was feeling myself. I was like, oh, you know, I'm fresh out of grad school, got a job in my field. I'm doing great. And so at that time, you know, it became like a struggle. You know, at this time I had my first apartment. You know, I have adult responsibilities. And so, you know, I start panicking a little bit about being out of work. And so I began applying for other jobs. And my stepsister happened to work at American Cancer Society. It's like, oh, Nick, I need a intern. So I began to intern with her part-time. And so during that internship, I learned how important it was to always, you know, maintain a positive attitude and to keep faith, even when the odds are working against you. And I sat down with her supervisor and just kind of let her know, like, I'm interested in epidemiology, blah, blah, blah. Just again, you get a foot in the door. It's always best to take advantage of those relationships. And so she encouraged me to go to talk to the epidemiology side of the house to see if they had any projects or anything that I can work on. So again, in every position that I had, I always had the end goal in mind to be an epidemiologist at CDC. And so by any means, I need to, whether I was mopping the floor or whatever, if there's an epidemiology department, I need to be discussing or talking to them and volunteer my time to get that experience. And so I was always persistent and just really strategic in my job search. And so, I continued to interview, continued to seek advice on my resume and CV revisions. And so I remember I was again applying for jobs at CDC, and there was a lady that I met. I was applying through some of the contractors that contract for CDC. And so Booz Allen, I think, was one of them. And I forget another one. And so I've been aggressively applying, and I always called to follow up. And there was a lady that in their HR department, and she remembered me because I was so persistent. And so she's like, Niketta, I'm going to give you an interview, And so she gave me an interview. And at the time, I did fluff my resume a little bit. And so when it comes to technical skills, you can't fluff technical skills. And I remember being in an interview with some CDC representatives, and they were drilling me about SAS coding. Oh, you said you're an intermediate SAS user. They were like asking for specific coding language. And I was just like, oh my God, freaking out. And so the interview didn't go too well. And so she did provide feedback. And so she let me know, like, fix your resume, don't fluff it too much, and just gave me advice. But she continued to create opportunities for me. And so I began to get comfortable with interviewing and group interviews. Again, all these, even though it was a time of my life that was, I guess, a humbling experience, it created room for growth. It taught me how to interview in group settings and panel interviews. It gave me the confidence I need to serve what was on my CV and to be confident with the experience that I gained so far. And so again, utilizing your mentors and collegiate connections are definitely beneficial for networking. And so at the time when I was the humble servant, I was out of work. I was working part-time at American Cancer Society. I was bartending. My stepdad owned a bar and grill. And so I was a bartender. I was bartending. And I remember this man walked in and he had a CDC polo on. And I'm like, oh my God, he works at CDC. I need to talk to him. And so his name was Donald Mixon, and he sat at the bar. And I immediately run over and I'm like, hey, how are you? And, introduced myself. And I was like, I'm interested in seeking opportunities at CDC. And so, we had some casual conversation, and he gave me his business card, and I followed up. So it's always key when people give you a business card or you network, it's always important to follow up immediately. And so that fostered my relationship with Donald. So he began to serve as a mentor to give me advice on how to make the search for CDC positions, how to interview, things of that nature. So I began to apply for state epidemiology positions. And so I started to interview a lot with the state. And eventually I landed 2 jobs at one time. I got an offer from the state for an epidemiology position. And at the same time, I got an offer from the Food and Drug Administration in Maryland. And so he advised that in the job at FDA was a fellowship. So it was not a permanent position. It was a 2-year assignment as an Epi fellow. And so he advised, like, if you receive your goal is to work for the federal government. If you're given the opportunity, you take the federal job or the state job. And so I did. So I became an Epi fellow through the ORISE fellowship program, which I highly recommend for recent graduates of MPH. If you're looking for opportunities to get into the federal government, being an ORISE fellow is the best way in. And so as an ORISE fellow at this point, again, I learned my lesson from, my first job. I'm going to go here. It's a fresh start. I moved to Maryland, and I met Emily, who's pictured here. Emily was an epidemiologist. She had been there maybe 9 months prior to me. And Emily and I became really good friends, and kind of like I consider her like my battle buddy, but she's became like my peer mentor. So we always mentored each other. We always held each other accountable. And so again, when you're offered opportunities, it's best to establish your presence within the organization, again, by being a team player and by being a leader. And so we both ensured that any project we worked on, we both shined. We worked very hard to, ensure that we initiated any changes that needed to be made to improve the reports that we were responsible for. We identified our areas of weaknesses, and we both, again, challenged each other to grow. Well, Nikki, you said you were going to work on this. You're always about 5 minutes late for the meeting. You want to, improve that. It doesn't look good. So Emily definitely held me accountable. And then 2, you want to develop, enhance your technical skills with every job that you had. So this position too required a lot of coding and SAS. I also learned how to develop reports and various tools. They had a lab as well. So I had the ability to cross-train. This was with the NARMS program, the National Antimicrobial Resistant Monitoring System. And so had 3 branches, one at the CDC focused on the human side, FDA focused on the food element, and USDA focused on the on-farm portion of the project. And so I was able to cross-train in the food microbiology lab. And so I learned more about antimicrobial resistance and things of that nature. And so that position really taught me a lot about just how the data was developed in the lab and just transmitting it, to the data side. And so I had a great relationship with my colleagues. And again, just setting goals and planning accordingly, sitting and talking with my, the employees that were there that were, more seasoned than I was. I also made sure I had an open dialect with my supervisor. In any position that I have, I'm very, very strategic in sitting with my manager or my supervisor and talking about my future goals, because I think it's important that they understand that so that they can create opportunities for you that will feed into that. And so that's what I did. And at the time too, I was, interested in pursuing a doctorate degree as well. And so that was always the goal too. And then also never get too complacent. And so I was on a softball team, and Emily and I played softball at FDA, had a softball league. And on our team, and that's why I said it's important to build relationships and to know, just to get to know people in different settings. We had directors, like different type of management individuals that were on our softball team. We were some of the younger players. And so we created really good relationships with them. And so Emily also told me about the Commission Corps because she was a little bit more familiar with it. And so when she mentioned it, I was like, oh, I should look into it. And when I looked into it, I'm like, oh my God, the benefits are amazing. It looks great. I should definitely join. And so I went ahead, ironically applied to get into the Commission Corps before Emily. And so going through the process, I began to look for permanent job opportunities at FDA. And there was a director on my team, Wayne Gorski. And I mentioned to Wayne, I just shouted out loud, like, I need an epidemiology position because my fellowship was ending. And, oh, anybody need an epidemiologist? He was like, actually, I do. And so he invited me over. I got to sit in a meeting with his team to see if I was interested in it. And this position was in the Office of Emergency Operations at FDA. So working with outbreaks, which is something I wanted to do. And so, I was extremely excited. And so, that opportunity presented itself. So next thing I want to point out to you is that the importance of attending professional conferences in order to enhance your presentation and public speaking skills. And so as an ORISE fellow, ORISE offered the opportunity for their fellows to attend some of these conferences. So I guess they call them scholarships. I forget what they call them. I don't know what they call them now, but you had a certain amount of funds that you can utilize to attend these conferences. And so those offer opportunities for me to get experience in submitting abstracts and posters and things of that nature. And so that helped to build that area of being a scientist or being in that realm. So fast forward, December 2011, I commissioned into the U.S. Public Health Service. Immediately upon commissioning, you're assigned a mentor through the category in which you're commissioned in. And so Captain Gabriel became my mentor, and she immediately sat me down during lunch and we set goals. She pretty much mapped out the Commission Corps for me, the importance of being involved and active within my category and things of that nature. And so we created pretty much a career trajectory or career plan for my public health service career. And so I began to volunteer for a lot of public health outreach opportunities. Again, these are opportunities for networking. These are opportunities for, expanding your skill set and just developing some of those very basic foundational leadership skills that are critical as you excel in your career. And so I began to volunteer a lot. Also, within the public health service, there's tons of opportunities for public health training. And so I began to train not only for your deployments, but you have all kind of emergency management training that you gain. And then also during deployment, that on the boots on the ground training you cannot beat. You also want to join professional organizations. Again, expanding that network, creating opportunities for different and a variety of trainings. And so all that is essential in your development as a public health leader. And again, I'm gonna highlight, attend and present at professional conferences. So USPHS, we have symposiums every year. And so the symposiums allowed me the opportunity to present at roundtable settings, to present posters, again, to interact and see what other public health professionals are doing within the federal realm and also within the Commission Corps. So it's a great way to network. And so again, my end goal had always been to be an epidemiologist at CDC. So even while I was at FDA, anytime I had the chance to go to symposium, I always went with a printed CV, cover letter, and a business card. So I created portfolios, and I would create at least 5. And so I would go to these conferences and I would network, specifically targeting people that were in a leadership role at CDC. And I would ensure, I was like, I got 3 to 5 resumes. These need to go into the hand of someone that can be a benefit for me in the long run. And so I'm a member of Delta Sigma Theta. And so that opportunity also is another network. And so I was at symposium and I met some of my sorority sisters, and they were at CDC. And this year, I think it was in North Carolina or somewhere. And so following the symposium, I was actually coming home to Atlanta. And so I met them and I was like, hey, I'll be in Atlanta. And so they invited me on CDC's campus, and they was like, come to the campus and we'll walk around, introduce you to some people, just so that I can start networking. And so that's how I began to expand my network at CDC, to personally meet individuals that were, again, in places where I wanted to be, and to get my CV circulating in the agency. Oh, and here's a picture of me and Emily. Again, I commissioned before Emily. Emily commissioned in 2012. And we are accountability partners to the extreme. So when I say you need a battle buddy or someone that will be a peer mentor, someone that you can grow and build with in the field of public health, Emily is that for me. So if you know me and you know my story and my journey, then you know of Emily. To this day, any job opportunity we have or change in career, we're going to consult with each other. Hey, what do you think about this? Blah, blah, blah. And so last year, we both were up for promotion to commander, which is a very competitive rank in the military, and especially in the Commission Corps as well. And so just in all transparency, this was my 3rd time going up for promotion. I missed it the previous 2 years. So last year I was promoted to commander, and so was Emily. So it was that more meaningful that, we both were promoted at the same time. And again, in the previous slides here, like, again, award ceremonies, whatever, we always held each other accountable. When we both commissioned in the Corps, I think 2014 FDA awards, we both left with like almost 7 awards each. But again, just having that accountability and ensuring that our professional growth was on track. And so, yeah, she's my battle buddy. And so moving forward, so pretty much I kind of gave you all the rims or the transitions that I went in, which I feel like continue on. Like, I'm always the mentee. I have at least 3 to 4 mentors that I consult with for any major decision that I'm making professionally that will, impact, my career long term or excel me in any way. I'm a commissioned officer. I'm always the rookie. Any new position that you have, when I deploy to the field, typically you're deploying your assignment you'll learn when you get on the ground. And so again, you become the rookie again. So knowing how to learn quickly, knowing how to leverage those technical skills or whatever is required for that position is very essential. And then also the humble servant, always being humble and always willing to learn, also being able to address where my weaknesses are, what my mistakes were, and to grow and learn from those. And then being the student, you're always a student. Public health is ever changing, especially if you're working in infectious diseases. It's always changing. So it's very important to understand that you're not going to always get it right. You're not going to always know everything, but there are resources available that will teach you and keep you up to date. And then also being the competitor. It's important to know how to market yourself, know what strengths and assets you bring to the table, and knowing how to sell that and to leverage that for any position that you may receive. And also being a mentor, always giving back, always reaching back. So any chance that I get to talk to public health students or those that are interested in public health is very important to me because others did it for me. And I think it was so critical in my development to have those individuals a part of my journey that had it not been for them, I would not be where I am. And so also as a public health service officer, I'm Commander Niketta Womack. And this past year has been very busy and trying for us. I probably spent more time on deployments than I have in my regular position in STD. And so again, that little circle that I showed y'all, when I'm out in the field, I'm operating off of that. The picture in the bottom right is my graduation from Officer Basic course. Picture in the top right, again, is a training that I was attending for emergency training. And the two on the left are deployments, specifically for COVID. Bottom left, I was in California, and the top right, I was in Chicago. But just having that flexibility, being a great team player, understanding the foundation of public health, and staying plugged in. And when I say that, it's so important to know where the field is going and headed, and trying to seek trainings to prepare you for the direction in which we're going. Also, here's some extra tips. Write down your goals. I'm so goal oriented. I write down everything: personal goals, professional goals, financial goals. It is written down and documented. So anyone that knows me or that's been around since my undergrad years will tell you everything that I'm living, I spoke it into existence. I worked hard for it. I documented it. I strategized every position I had to build up my skill set, my trainings, so that I would be eligible for the positions in which I sit in today. Also, it's important to network up. And when I say this, I mean you network with people that are where you're trying to go. Yes, it's important to network with your peers and people that are kind of on the same page as you, but it's very essential to meet people that are where you're trying to be. And also, it's important to know how to build your network, because I notice a lot, people reach out to me all the time. A lot of people know how to network. And I view networking as just meeting people, being able to share commonalities with people. Yes, that's cool. But how good are you in sustaining those relationships? And that's why it's important to not only call when you need something, or, to kind of build a personal connection with people, make it genuine, be real about it. And that's how you build your network. And so now I have a network that is massive on people that I've done things for, they've done things for me. It's a mutual relationship. It's solid. And so if I need a favor, or if I need something, or I have a mentee that's looking for this opportunity, can you connect her with such and such? It's not a problem, because I've sustained those relationships. Also, it's important to know exactly where you want to go. People will reach out. Hey, I want to work at CDC. Where? CDC is huge. Know exactly where you want to go. Oh, I want to work at the Center of Infectious Disease. I'm interested in this division, specifically this team that works with foodborne and waterborne illnesses. Know exactly where you want to go. Help me help you. And so it's important to do your own research and to understand wherever it is you're trying to go, whatever agency or area you're interested in, at least know the basics so that when you start to network and reach out to people, you have specific questions. Because I'm not going to do the work for you, and I don't have time. So it's important to know where you want to go so that people can help you. And it's very pleasing to see individuals that are driven, that are excited about public health and wanting to learn more. Like that eagerness, it makes me elated to help you. Like, okay, I can't wait. Here, do this, do that. And then you run with it. Okay. Also, I recommend that you find your dream job, and then you design your career plan based on that. So I always tell my mentees to go to USA Jobs. You want to work at CDC, go, or for the federal government, wherever you want to work, go on their HR page and you look for that specific job. And you look to see what those requirements are. What type of skill set does it require? What type of education does it require? And that's how you build your career plan. And know the industry and the new developments. Because I feel like sometimes when you're doing your MPH or you're in school in general, by the time you graduate, some of that information may be outdated. So it's important to know how to tap into your mentors, know how to pay attention, what's going on in the industry, what type of skill set, what type of tools are new that they're using, and seek those trainings while you're at school. So while you're paying for the education, go ahead and take the courses or electives that are going to be of benefit when you graduate. Also, again, obtain new skills with every position you serve. Not every job that I had was specific to epidemiology or infectious disease for that matter. But my goal was while I am here, I'm going to learn as much as I can. And it's important to differentiate yourself from the 50 million other epidemiologists that are where you are. And so that lab background was my niche. So it's like, this what separates me from other epi. Not only can I help you with your data analysis, your disease surveillance, but I can also help you generate data by assisting in the lab when you're backed up and doing things of that nature. And I'll use an example. I was deployed for Zika 2016 to the US Virgin Islands. I was sent there to serve as the lead epidemiologist in the response there. And when I got there, there was a need for lab assistance. And I was able to step in and help because I was also trained in the lab. And so again, you want to be able to cross-train and you want to be able to market yourself in a way that others cannot. Also, like I said, know how to market yourself. I always tell my mentees, never say you don't know how to do anything in an interview. If they ask you something, hey, have you ever, are you familiar with coding in R or whatever? Like, don't say, no, I've never done that before. Just say, oh, no, but I have coded in SAS and I can leverage that skill to apply it here. Like, know how to sell yourself. Be confident in what you bring to the table and what you have to offer. And I think that's very important in any profession, and especially public health. Also, allow your rejections and your failures to serve as lessons and motivation. So do not be discouraged. I've been rejected so many times in everything that I've pursued. And yes, it hurts, but it's a part of the learning process. And I'm the type, I'll cry for a little bit, but then I'm going to bounce back and I'm going to come back and I'm going to say, what did I do wrong? How can I learn? How can I be better next round? And that's the attitude that you need to have in order to become an effective leader in public health. That is it, folks. So I'm now open for question and answers. Hopefully I did not go over time. And yeah.
Wow, Dr. Niketta, this was an excellent presentation. Thank you for sharing your anecdotes. Thank you for sharing very practical tips in your journey to your professional career, and then also just talking about what it takes to emerge as a leader in public health. We do have a lot of audience questions, but before I take them, I just wanted to ask some leading questions that would help just, round up what you've said. Public health leadership is, you can equate it to leadership in almost every sector, but there are some nuances like you have highlighted. So what would you say are some enablers or barriers to leadership in public health?
Some barriers, I would say, the lack of versatility overall. So again, I think I spoke a lot throughout my presentation, how important it is to cross-train, to understand different areas of public health. if you emerge as a leader in public health, you are expected to understand some of the other things that play into bringing the bigger picture together. So whether it's the finance side, whether it's the policy side of the house, like understanding the different components of public health and how that all ties into what it is that you're responsible for.
That's really great. So how would you define effective leadership in public health then?
Effective leadership. In order to be effective in public health, I think people skill. Public health, like that component. Everything we do is to serve the public, the health of the public. And in order to do so, you need to have empathy. You need to have an understanding of not only the health side of the house, but how it impacts the entire public. And I think in order to be an effective leader, not only understanding your role in this equation, but also how the population is impacted by it. But so understanding the full story. And again, knowing how, I think all aspects of the equation, who collects the data, who does the lab work, who does this, how does that pour into the reports, the case counts, the things that's reported, how does that impact the policies and the decisions that we're going to make as a result of these data that we're seeing? How does that impact the people that are going to have to implement these policies at the state and local levels? Understanding the overall picture, because it's not a one-sided thing, and public health is all linked. What we do at the federal level is trickle down to the state and locals, is trickle down to the people that they serve. And so it's essential to get it right. And in order to do so, you need to understand it from the bottom up rather. So.
Yeah, that's really great. Again, wow, just hearing you, we're having, some comments from our audience, just really talking about how this has been a great presentation. And like I said, questions really coming up. Last, before we move to audience questions, and my co-panelists also ask, you had mentioned specific relationships that you have. And I think in the leadership world or business world in general, we talk about mentorship, we talk about coaching, and we talk about sponsorship. Can you touch on those different components and how those have influenced your path to leadership?
I'm big on mentorship. I live it. I'm very big on mentorship. And when I say that, I mean, in the sense, it's so important, again, to talk to people that are where you're trying to go. And because as a student, you don't know what you don't know, right? You only know what the book says, what your professors say. But when you start working, you realize like, oh, I thought I wanted to be an epidemiologist, but I actually don't like it. You know what I'm saying? What are my options at this point? And having people that are in those positions that can say, okay, here's how you navigate this, or creating opportunities for you. And for me, my mentors were amazing. Like there's jobs I didn't even have to interview for, just by having the right people in my network and having a good rapport with people. And they see my application like, oh, Niketta, you applied for this. What are you trying to do? Blah, blah, blah. And being transparent with what it is you're seeking professionally. And I'm clear, when you're interviewing for a job, it's both ways. You're interviewing them and they're interviewing you. So you need to see if it's a good fit for you. And it's okay to ask, to be transparent. Like, this is what I'm interested in. Can I gain this type of experience in this role? What are the opportunities for growth? What are the opportunities for trainings? Because you don't want to become stagnant. As a public health professional, if you're in a position that's not providing you with the trainings, allowing you to go to conferences, allowing you, to interact and to cross-train, it's going to limit your growth. You're not going to be marketable after 2 or 3 years. You sat in this role. It's time to go to the next level. You don't have enough skill set technically. You haven't developed any new technical skills. You haven't developed professionally or whatever. You're not going to be as marketable. It's going to be hard. So you're kind of stuck. And so you want to avoid those kind of roles. And again, just make sure that when you're networking, when you're interviewing, that you are asking the right questions and you're, paying attention to the interactions. And so that's why I appreciate panel interviews. So panel interviews that we have at CDC. You'll get leadership. So like, I'll give you an example. When I interviewed for the position I'm currently in, I interviewed with my supervisor and his boss first. I spent an hour with them. They drilled me on my technical skills, things of that nature. And then I got to sit with the staff for an hour, and they interviewed me without the supervisor being present. And during that time, I got to ask a lot of personal questions. What is your experience like here? Because no one wants to work in a toxic office environment. You know, what's the growth been like? What's turnover like? You want to ask those kind of questions so that you don't put yourself in a position that you end up getting stuck in. So I don't know if I answered your question. I kind of rambled a bit, but hopefully I was able to cover some of what you were seeking.
Yeah, no, you did. And I think, again, in the interest of time, if you just want to quickly talk about how you've had mentors versus sponsors versus coaches in your career growth.
Okay, so a mentor, most of my mentor relationships, so I have a mentor for every aspect. I have a Commission Corps mentor that prepares me for, you know, promotion within the Commission Corps, that teaches me how to navigate the Commission Corps. This is what you need to do next as an officer. I had a mentor that was one of my professors from Tulane. And so Dr. James is very critical in not only supporting my professional growth, he's always written letter recommendations for me, but he's also been instrumental in connecting me outside of the federal realm. So in academia, helping me to create and build the networks there. I have mentors that are critical in life, that teach me how to balance my career as an officer, as an epidemiologist, and to seek things outside of that. I also have spiritual mentors that I work with, you know, to grow spiritually. And then also in regards to coaching to me, coaching is very, is more specific. So I went through leadership coaching this past year. My job, you know, was able to contract with an outside consultant to get me to leadership coaching. And so her goal was to not only assess where I am currently professionally, but we talked about where I was trying to go within the agency and what she felt like I needed to do next in order to meet. So kind of like that career planning I discussed earlier, she's helping me with that, but more at a leadership level. Because when you start playing with the big dogs, there are different requirements. There's different expectations, especially as a Black woman. So, you know, the game changes a little bit. And so she was very critical, and she recommended that I do an emerging leaders program at CDC, which I'm currently working on the application. And we got support and buy-in from my supervisor in my office. So leadership coaching, again, or for me, it was more specific. Like, I have six weeks to teach you how to elevate. And she coached me through it. And so that's kind of what I view the coaching is very specific. Whereas mentoring is like whatever I need, I call, hey guys, I'm confused about this, but the coaching is very specific.
Yes, thank you, Dr. Womack. Again, this is a very enlightening conversation. Thank you for sharing your journey. And I mean, I love the fact that you were able to talk about how you highlighted, you know, various goals that you created and then how you designed a path towards reaching them. I think that was very helpful for a lot of our listeners. We wanted to go to a couple of the questions in the chat.
Okay.
I believe one of them was talking about, can you share, thank you, Ashwin. Can you share any tips on how to strike and maintain a healthy work and home life balance?
Yes. Okay. So I'm going to give y'all some examples of things that I've battled with recently. Because currently, again, as a Commission Corps officer, I've been on the COVID response for all year. Since the early year, I haven't been back to work. And so I go back to work on Monday, but I still have to serve on the response as well. So I'll be doing 50% of my time. So again, it's stressful. Also, I've been working on a doctorate. I just finished my doctorate. And so being a student. And so what I find helpful, there are apps, guys. There are apps for all of this stuff. Like, we live in a time where, when I tell you there's an app for everything. And so there's an app called Time Block. And so what I would do is I would put in my meetings on time block, and I would block out times during the day to mentally rest or to allow myself some personal time. But you have to schedule it. Schedule personal time, but if you don't plan for it, your days are going to merge together. In the mornings, I have prayer, meditation, and workouts. So in the morning, I'll wake up. My workouts typically start at 6 or 7, depending on the day with my trainer. I wake up an hour before that. I pray and I meditate. And then after that, I'm off to the gym. Knowing what activities ease your stress and creating a space in your day for those activities. In my sorority, I'm very active in the community outreach component. And so I have certain hours they can ask me for stuff. And if they call me outside of those, I can't help them. They're like, Niketta, can you help? It's out of my Delta hours. I can't help you. You have to call another time. Catch me tomorrow at 7. But creating those boundaries, you have to create boundaries and you have to create a schedule and almost block out your personal days. Like this weekend, I'm not going to do anything. Say it and put it on the calendar. And this will be your I'm not doing anything weekend. But you have to schedule it.
Yeah, thank you. I also heard through the grapevine that you enjoy cooking as well.
Yes, I do. So I am a chef on the side. Cooking is another one of my stress relievers. And so when I'm not cooking, I'm more stressed. So just imagine when I'm in the field deployment, it's tense for me because I can't cook. I have to eat out a lot, which I absolutely hate. And so cooking relieves stress for me. I love plating. Also, I do have a cooking business on the side where I do provide personal chef services. But I'm going to kind of give that up too, because again, it's another time consuming thing. So kind of learning, again, how to limit my commitment so that I can do better in having that personal time. So yeah, but I do love to cook.
Thank you.
Right. Any other questions?
Thank you again, Dr. Womack. We have a couple of other questions, but in the interest of time, maybe we can select a few of them here. Maybe we'll start with do you recommend to do networking using informational interview with staff in the department or organization Modude is interested to work in?
That you are a part of already? So do you recommend networking with the staff in the department or organization I'm interested to join? Yes. Okay, I'm gonna give y'all some background. I can be I'm not gonna say stalkerish, but I'm very driven. So if you have, and I tell my mentees this, I have a mentee that's currently fellowshipping at CDC. And so I'm like, you have access to the intranet. You have access to contact information from every individual in the office that you're interested in. It is okay to reach out. And I showed her how to do it via LinkedIn. LinkedIn is a great platform for it. If you know where you're trying to go and you know pretty much individuals that are within that office or you can see it, yes, reach out, create a professional paragraph to virtually introduce yourself. I've done it before. Hi, my name is Niketta Womack. I'm currently an Epi student, or I'm currently working in such and such. I saw your profile, or I saw this about you, and I'm very interested in learning more. Specifically, and again, it's very key to know exactly where you want to go. Specifically, I know that the team of such and such works on this type of work, blah, blah, blah. Give a brief spill. And I have previously attached my CV and a cover letter, just, whatever. If you guys have any opportunities, I would definitely love for your consideration. Or if you're open to a conversation, I would love to speak with you more. It's absolutely okay. It's all about how you package it. You know what I mean? It's all about how you package it.
We have one more. How often should I be in contact with a mentor and professor to build a solid relationship with them without being too bothersome?
It depends on, again, the nature of the relationship. And then also if you're only reaching out when you need something. That's why I said that's not how you build those relationships. If you are only contacting your professor or mentor when you need something, then no, you should not do that frequently. However, if you're just like, hey, I have this going on, blah, blah, blah. And my thing is too, I'll give you an example. I'll have people reach out to ask me for letter of recommendations. I'll write the letter of recommendations and I get no updates. I don't hear from them until they need a letter again. That is not how you build those relationships. If someone writes you a letter of recommendation or someone sits and gives you advice on how to get a job or interview advice, you follow up with them. Hey, so I had my interview yesterday. It went great. Thank you so much for the advice. I truly appreciate it. You show gratitude. That's how you build those positive relationships. So again, it depends on the nature of the relationship. Some mentors I talk to maybe once or twice a year or 3 times a year, and some more frequently because we had a more personal relationship. So it just depends on the nature of the relationship. And when you're in a position to get back, you do so. Like a lot of my mentors, I give you an example, my mentor from UGA, Dr. Arnold, he mentored me like undergrad. So once I became, I guess, successful, I would go and speak to his interns as a payback. Oh, you need a professional, public health professional, come back and talk to your students. I'll come down and talk to them. And so that was the trade-off. Like, so you give back, so it's a two-way relationship. And again, don't just call when you need something,
That's okay. Yeah.
Okay.
It's all good now. This is really, really helpful advice, Dr. Niketta. And like we said, we know we are kind of like top of the hour now, but there are some questions we really want to address because our audience have been very interactive. So I would merge these 2 questions because we have 2 audience that have asked about applying into the US Public Health Service and what that experience is like. I think we've had about 2 or so people who applied and wanted to just know what the standard experience is.
Okay, so the application process for the Commission Corps, what it currently is, of course, is different from what it was when I came on. When I originally commissioned, you were required to receive congressional approval before you were commissioned. So they would submit your name before Congress. Congress would have to vote on the list. And then, at that point, you would be eligible to seek federal assignment based on your commission status. And you had to find a job after you were commissioned if you were not already in a permanent FTE position with the federal government. However, now they've changed it a lot. I think there's an interview process where it's very competitive to get in the Commission Corps. Very competitive. They have recently opened up applications. Again, don't quote me too much. I don't keep up often. But last year, applications did open up across the board, which has not been done in years. And so if you are interested, I advise you to take advantage of the opportunity now. Contact the recruitment numbers that are online on USPH.gov. Go there, read information. Depending on what your education is, you are commissioned based on your education as well as your time in service, things of that nature. So like with me, I commissioned as an epidemiologist or a health service officer. And so I was evaluated based on, they look for your credentials. So you have to have a degree that is in alignment with the area in which you're commissioning. So I had an MPH in epidemiology. I had a work experience in epidemiology. I commissioned as a health service officer, primarily serving as an epi. If you are a dentist or a physician or a pharmacist, for an example, pharmacist, of course, you're going to have a Form D. You're going to have, if you have some experience as a pharmacist, and our pharmacists are also required to complete pharmacy hours after they commissioned as well. So you have to maintain that license as well as the physicians and the dentists. And so, again, your degree needs to be in alignment with your experiences. There are 3 components to the application. You have, of course, the basic professional side of it. Then you have to go through medical clearance. You have to go through a background clearance. So there are components similar to joining the military. So it's very stringent. It's a lengthy process, so be patient with it. The headquarters of Commission Corps is very limited in staff. And especially right now, we're in the middle of a pandemic. And so we're all hands on deck. And so they're responsible for, rostering us to go out the door and things of that nature. They're dealing with a lot right now. Also be mindful, we just had a change in administration. We have a new Surgeon General. And so that, again, he pretty much manages the commission corps. And so if he has certain initiatives and things of that nature, things may change a bit. So again, it's very critical to, in this process, to stay at it, stay on it. Make sure your documents don't get lost. Keep copies of everything you send. Follow up, stay on top of it. But yeah, Commission Corps is great. I have had nothing but positive growth professionally as a Commission Corps officer that I don't think I would have been afforded as a civilian. And so I'm grateful for my experience. Again, definitely open to discussing it more. But if you are considering joining the Corps, I recommend that you do that now while things are kind of open, because once they close, we don't know, what's what. So.
And do you recommend applying right after graduation, or wait until get some more experience and fellowships?
What, for the Commission Corps?
Uh-huh.
If you're a student, we have a co-step program where you can apply to as a student, which I recommend if you're interested in. Probably it's best to come in as a student. You'll receive your assignment upon graduation. You'll be assigned to a federal agency and commissioned after that. So it doesn't matter in regards to the commissioning. It depends on what degree you're seeking or what area you're commissioning in. So I would just say it depends, but apply when the applications are open or you may miss out. So yeah. Hi, Emily. So Emily is the one that was in my presentation. Emily's my ride or die, my accountability buddy. So we literally tag team our entire careers. We've served as each other's accountability partners. So yeah.
That's really great. And thank you so much for joining, Emily. We do have a couple of questions from people who are asking how somebody with an international experience, so basically international public health students in the US, can also rise in their careers in public health. Like, are there any extra tips or extra considerations?
Yes, so I do have a mentee who's an international student at CDC. Lakshmi is, I think she's a Title 42 now. So when she came on board, again, I think struggling with the visas, the work visas and the expirations of that. So she's had to juggle a lot with that. My recommendations for international students, personally, I can't give you any specifics because, again, that's not my realm, but just based on what I've seen and learned from her experience, you need to be as public health wise, your technical skills need to be A1. You need to be of a great asset. So for people to, want to keep you on board, want to keep you working with them, and want to create more permanent opportunities for you, you have to sell yourself over and over again, unfortunately. And I think that's done by making sure your technical skills are up to par and by also creating healthy relationships. It's really about who you know within CDC, any organization. Those relationships that you build are what's going to kind of elevate you, because everybody, it's a very small public health world and you do not want to burn any bridges. And people will say, oh, she's a great worker. I've worked with her. I think she'll be great for this, blah, blah, blah. People will create opportunities for you. If you are a great worker, you have good technical skills, you're growing with the industry. That is key. Grow with the industry. If you are an international student, leverage your, what other languages do you speak? Target those areas, So again, when we're in pandemics or we're in emergency responses, I'll use Ebola for an example. There are certain languages they were looking for people to know, in order, we need this kind of support. Do we have people that speak this language and that can do epi and that can do this? So if you speak multiple languages, that is your selling key as an international student or anyone that is bilingual. So you want to, again, leverage all kind of skills that you have in different realms and don't limit who you are. Sell it. You just have to know how to market and sell yourself.
Well, that's really great. A question just popped up, which was timely because it's talking about relationships. So it says you highlighted how it's you highlighted how important relationships. how important it is to build relationships. How do you achieve this if you are really introverted?
If you are really introverted. So again, earlier we talked about goal setting. I gave you an example of how I was going into college. So I'm gonna give you an example too. I moved back to Atlanta 2015. I moved back with the expectation Atlanta is home for me. I'd been in DC for I think 7 years. And so I had been away for a while, you know. I moved there, I was 25. I moved back. I'm now more a well-established adult now. And so I'm thinking it's home. It shouldn't be a difficult transition. And so when I moved back, I realized I don't have friends here. I don't have a network here. I don't have a life here. And so I started going to networking events. I started going to young professional networking events. And again, I do have an introverted side, especially in a room in which, again, I would go by myself. And so I started setting personal goals. So this is what you can do. When you go to networking events, or whatever, set goals before you walk in the door. So I would say my goal is to talk to 3 people I don't know. To meet at least 3 people, I'll start there, that I do not know. Because naturally, your comfort zone, you're going to navigate towards the other introverts or the other individuals you're most comfortable with. But I was like, no, I'm going to talk to 3 people I don't know. It's complete strangers, and I'm going to find a commonality, and I'm going to have a conversation with them. And it starts there. And then the next thing I know, somebody else walked up, and now we have a group conversation, and I've met all 3 people that I was supposed to meet when I came here. And, you know, I was able to exchange information, and some of them had nonprofit organizations that I was later able to volunteer with and build those relationships. But you have to set those personal goals. You have to be intentional about getting out of your comfort zone, or it's not going to work. You have to be intentional.
Maimuna?
Yeah.
No, thanks, Ashwin. I thought you were taking the next question. I think we've actually had people again just saying thank you for the tips. Somebody had asked if you can share, if you're willing to share your presentation with them afterwards. So just wanted to know if that's okay.
I possibly can. Let me screen it to make sure. But yeah, it should be fine. It should be fine. I'll PDF it or something, and then we can figure out how to share it.
Perfect.
But also, otherwise, this video will be, it's recorded. It's going to be on YouTube.
Yeah, that's fine.
That's true. That's very true. And again, we usually often ask, interviewees what their social media handles are and how our audience can reach out to them. And somebody actually already asked the best way to connect with you. So what is the best way to reach you?
Of course, LinkedIn. LinkedIn, I'm Niketta Womack, Niketta Womack, Womack. I am on social media. I have 2 accounts. I'm Nick Wo on Instagram, NIKWO. So that's where you'll see my fun side, more of my personal life things. I don't share as much professional, or I'm not gonna say professional, but it's me. You're gonna get the real me on Nick Wo. And then also I have a cooking page, which is Niks_kitchen. So it's NIKS_kitchen. So that is also on Instagram. So I'm not on Facebook, but if you have professional questions or any questions you want to follow up on that were not addressed here, the best way to contact me is on LinkedIn. So just inbox me there. I'll try to get to you. That box is so full. I really need to go through it. But overall, I try to respond as much as I can.
And we will provide those links in our description as well, right after this interview.
Okay. Thank you.
Yeah. Well, thank you so much, Dr. Womack. I learned a lot, and it was just an amazing conversation. And when you started the conversation by saying, we interview heroes in this program, and you're such a true hero and a gem to the United States.
Thank you.
It was incredible listening to you talk, and really you didn't shy away from hard conversations, and you the way you answered each questions, where you didn't talk about leadership, you demonstrated leadership today. So through your life, and really to learn that you went through each and every failure in your life, and you have learned through it. Whether it is the, when we see spreadsheets, we are bored, but you have converted all your difficulties and things that usually people might think as odds into something positive, and those are truly inspirational to any young public health professional, and it was totally for us today. We were just our minds were blown today with
Thank you guys.
And especially the mirror neurons were just firing as you were talking. So thank you so much for that. I will let Kelvin go, and then Maimuna can wrap up, and then you.
Yeah, no, I just, going after Ashwin, just thank you again so much for just being able to share your journey. This was very helpful to me, and I'm sure to a lot of the individuals that are, putting questions and putting thanks in the comments as well. So thank you so much again for joining us today.
Thank you guys for having me.
Yeah, just echoing Ashwin and Kelvin and our audience, thank you so much for your time, for your expertise. And like Ashwin said, we really appreciate you sharing all sides of your journey, the failures, the opportunities to learn, and being very real with us. We really, and thank you to Emily also for just showing up. And, your stories were very relatable. Your examples were very practical. And I'm sure not just our audience, but even we have learned a lot from it. Thank you again for your time. We hope we can bring you back again sometime to discuss something either specific in epidemiology or any other field of public health. I think it's really interesting that you had mentioned, striving for being cross-trained in public health, just because you want to be able to have, skills that are transferable in any setting. And I think COVID has even really taught us that, we have to be resilient as leaders. We have to make sure that we're adaptable and very innovative in our approach to public health and global health. So for all of our audience, thank you for joining today. Thank you for your time. We know we went above the standard 1 hour, but it was just really interesting to get to field all of your questions and to hear from the amazing Dr. Niketta. For us, we keep putting out content. We keep interviewing experts like Dr. Niketta. So please subscribe to our channel, follow us on Instagram, LinkedIn. And feel free to share any questions, feedback on topics you would like us to discuss, global health issues you would like us to address, and anything else. Once again, thank you so much, Niketta. Kelvin and Ashwin, it was a pleasure co-hosting with you all. And I wish everyone a safe, for those who celebrate Easter, happy Easter weekend. Please be safe and take care, everyone.
Yes, thank you guys.
Thank you.
Thank you.